So patients are becoming more and more educated. They look things up on the internet, and some of them scare themselves and some of them reassure themselves, and that can be appropriate or inappropriate, but overall it's a good thing. It's an engagement with their health. And so I think that's important. I think that's a good thing. When patients come to us, it's our job as clinicians to hear what they're concerned about and to address all of those questions, and then to explain from a scientific perspective and a function perspective what their expectations, what their goals are, what they do, all of that, putting all of that together to come up with a reasonable approach. So because they saw a test, that their neighbor had a test, or because they saw it on the internet, or because they've heard about it, read about it in Time magazine, doesn't mean that they need that test. And in fact, the more tests we do, the more frequently we'll find tests that are positive when there isn't the disease. So the last thing you want is to have a test that says you have an illness you don't have, and then we'll proceed with treating you for that. And that can happen when we start doing tests in people who have no risk of the disease. So for example, if we had a test to look for people who had a spear through their head, and you came in with a spear through your head, and your sister came in and had no spear through her head, I don't need the spear through the head test for you, and I don't require it for your sister either. Now your brother comes in and he has a little cut in his temple. He's not feeling too good, and he was walking through a room where people were throwing spears. So probably for him, because he has some what we call pretest probability, his chance of having a spear through his head is real, it exists, but we can't tell looking at him if he does. We need the test for him. And that's good use of testing. Whereas when I do it for people for whom I'm sure have the disease, or people I'm sure don't have the disease, that doesn't make any sense.